Perfect. Hello and welcome to Equilibrium. I'm your host, Bria. This is our Women's Health series, A Woman's Word. We're learning all about cardiovascular health with Dr. Fonseka. Thank you so much for being here.
Thank you for having me on your show. I'm really excited to talk to your community about our health today.
I'm so excited to learn all about this. I know absolutely nothing about cardiology, my heart, anything. So this is going to be amazing. Go ahead and tell me a little bit about yourself. What's your background?
So I'm from Philadelphia. I've lived here for quite a long time. I went to undergrad at Temple, medical school at Temple, residency at Jefferson, and then went back to Temple for fellowship. And then now I work in Philly. So I've been interested in heart health for quite some time. As my family, my parents, they all have one type of heart condition or other. So it's just been a natural interest for me, and makes it easy for me to serve my patients, because when I say you should take this medicine or you should do this or you should do that, I'm like, this is what I tell my mom and dad, my brother, sister, whatever, my family. So it makes it easy.
Oh my gosh. So what is cardiology? It's just the study of the heart, right? Or like the
Yeah, so it's the study of the heart and the vasculature system, really. So when people, it's a question that I've gotten recently on my social media is, what is heart disease? And that term is an umbrella term to describe any problem with your heart. Your heart is actually on the left side of the heart. A lot of people don't know that. It's sort of like on the left side, sort of angled a certain way. If you go on my Instagram, you'll see pictures of what the heart looks like and stuff. But the heart has its own electricity, which helps pump the heart.
Mhm.
And then it pumps blood to the whole body. So the heart's really connected to every single organ system. Problems with your heart will really affect all organ systems, because it is what delivers the nutrients, the oxygen, and such. So heart disease, I think people think of heart disease and they automatically think heart attack, which is part of the heart disease category, or like plaque buildup in arteries in the heart,
Right.
or
Yeah.
coronary artery disease.
Mhm.
There's also heart valve issues. So the heart has different valves that open and close. That's kind of that, in movies when it's like the heart beats on, it goes boom, 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 boom.
Mhm.
Well, those are actually heart valves opening and closing.
Oh, I didn't know that.
Yeah. So there could be heart valve issues, which could be congenital. That's something that you're born with. Things can be hereditary, which is something that you get from your mom and dad's DNA.
Mhm.
You can have rhythm issues, so heartbeat being too fast, too slow. So we probably heard of like pacemakers or ICD. So that's how that comes into play. There's also congenital heart issues, which is babies born with heart defects. So there's different holes in the heart that it could be, or the heart connection could be abnormal. So really, the term heart disease is an umbrella term to describe all those different pathologies of the heart and the vascular system. So we sometimes put like high blood pressure, high cholesterol, all part of the cardiovascular system, because that's what it affects.
Very cool. Very cool. I'm so much already. So tell me what you do on a day-to-day basis. Like when you come into the hospital, like tell me what you do.
So I'm a general cardiologist. Okay. So I went through training for 10 years. So the type of doctors who do heart stents, like if you're having a heart attack, that's an interventional cardiologist. A doctor that would put a pacemaker in you is an electrophysiologist. So that's somebody who's gone through more training than I have. So
Mhm.
I directly see patients. I mean, patients care always been my passion. I like talking to people. Like I'll talk all day if I could.
Perfect
So
right now.
exactly. So my practice is built where I'm 100% seeing patients. So I do a lot of outpatient work. Again, as a preventive cardiologist, seeing patients is what I do. And then every few weeks or so, oh sorry, that's my puppy. Every few weeks or so, I'll work in the hospital and see the really sick people. So I usually come in about 30 to 40 minutes, or like 45 minutes before my day starts, because I do pre-chart everybody. One thing that's really great about my practice is everybody shows up.
Mhm.
And that means when I'm like, okay, patient X, and I'll write down little notes about them, because the reality of healthcare is I don't have a whole lot of time to spend with each patient. So like I was talking before the show, it's like there are so many things about healthcare that I don't like. And there are so many things that I'm like, I'm going to fix it. I'm going to do something about it. So I hate, like, let's say you come in to see me, I don't know anything about you. By the time I ask a few questions, time's up, and that's not okay. So what I do is I spend a lot of my personal time reviewing your history, checking your chart. So like, let's say you're my new patient. Fortunately, if you tell us, who your doctor is and this and that, I'll get all those records. Wonderful staff work behind the scenes. So I'll say, okay, so she is this. Oh, okay. What medical problems does she already have? I wonder why she's coming in, looking at her labs, and really have an idea of who you are. And if
Mhm.
it's a follow-up patient, I mean, I see thousands of patients. I'll still look at the patient and say, okay, I know I'm making this name up, Miss Jane Doe. I know last time she came in with this, and this problem. Really kind of say, okay, what do I want to talk to her about? What medicine should we go up on? Should we go down on? Oh, I see her lab work. Oh, her kidneys are, we need to adjust something. So I do a lot of that stuff
Mhm.
before the patient comes in because I spend a lot of my visit educating patients and reviewing stuff. So I don't want to waste my time trying to refresh my memory because that takes time, really. So there's a lot that goes behind the
A
scenes.
lot going on.
Yeah.
So tell me, what is the number one thing that you say you diagnose with all of your patients?
We see a lot of high blood pressure and a lot of high cholesterol. That's definitely something common that we see. In terms of the most common like symptoms people come in with for a cardiologist,
Mhm.
it's chest pain, palpitations, feel like the heart's racing or skipping a beat,
Mhm.
um, dizziness, lightheadedness, fainting, swelling in the legs. So we get a variety of complaints that we work through.
Wow. Okay. Woo! Okay, so I have a few questions that people have submitted to us that they are want to know the answers from you. And I know we can't ask too many medical questions, like, or you can't give out that sort of advice. But I wanted to know, just in general, what are some things that if someone is in their early 30s, what are some things that they can do to improve their heart health starting now?
Perfect. So I thank you for, sending some of these questions. And unfortunately, it is correct that I cannot give medical advice. So this is really just for everybody's education and hopefully
Oh,
entertainment because
for fun.
so if I may go ahead and maybe share the screen. So the question that I got asked is preventative, how can you prevent heart disease at a young age? So we do have what we call preventive guidelines, actually. So when we talk about prevention, there are some things that are being researched and things that we know we should be doing. Um, Lifestyle is a huge component of what we do and what we talk about. And I don't think most doctors do a good job talking about lifestyle or weight. And there are many reasons for that. One of which is honestly, most doctors really don't have the time to open up. It's a little bit of can of worms these days, right? People are very sensitive to their weight or diets, and there's so many different diets out there, and some people swear by one diet and versus the other. So some people are fanatics, like some people maybe a keto fanatic who swears by their method, or a vegan fanatic, or what have you. So I think there are so many reasons for why some doctors feel a little nervous or about bringing up dietary sort of things.
Mhm.
So at the end of the day, you know what to do. It's almost like being cognizant of what you are not doing correctly. So eating vegetables, fruits, legumes, nuts, whole grains, fish is recommended to decrease cardiovascular disease.
Okay.
So there are a lot of people out there who say you must be vegan to be healthy, and that's not necessarily true because we know eating a piece of fish, piece of chicken is okay. It's not hasn't been proven to be bad. Even
Mhm.
if you eat a burger once in a while, or even if you do want to eat a steak.
It's just in moderation.
Exactly. But the term moderation, I don't think we do a good job about. I think a lot of us are busy. I think our lifestyle is not our number one priority, not because we don't want it to be, but because we have bills to pay, bills and taxes, and
Mhm.
student loans.
Adds up.
So I think that makes it really challenging. So even for myself, like if you asked me whether I'm a healthy individual, I would have said yes all throughout my life. And I don't think that was true. Just
Mhm.
because you don't go to McDonald's or whatever, it doesn't mean, oh, I'm healthy because I don't eat fast food. Well, that's great. It's great that you don't eat fast food. Like that's been me. I've never really
Yeah, me
eaten
neither.
fast food,
Mhm.
but I wasn't really cooking stuff at home. I was I wasn't eating a balanced meal. Like I wasn't eating a lot of fruits or fresh vegetables. And it's kind of like I look back and I'm like, what was I eating then? It's like some frozen meals
It
sometimes.
it's kind of, sorry to cut you off. It's kind of like what we talked about before, the video started, where if you don't have access to a lot, like if you don't have good grocery stores around you, if you're not able to go to like a farmer's market or something, it's hard to find good foods to eat and like fresh fruit and vegetables.
I think it starts from taking a hard look at like your diet and yourself and seeing what works for you. I think it's unreasonable for me to expect that all my patients will cook every single night. So that is something I recommend, is start cooking at home so you know what goes in your own food. I do it myself, even though again I work like 60 to 80 hours a week, but on a Sunday I don't like cooking, but I'm
Mhm.
like, but I have to because health is important. So I will sit on a Sunday and cook all day. I'm a mess. I'm a terrible cook. I'm like constantly burning down the
Really?
house, whatever. But I'm like, I'm gonna do this because this is important.
What's your go-to meal? Like, what are you always making?
Make some chicken, put some spices, random spices. I don't even know what I put it on. Like I have all these spice mixes. I'm like, "Ah," and I'm like, put it in the oven and voila, wait for it to pop out.
That's it.
But I like cutting up vegetables. That's been my favorite thing, just baking,
Is it
roasting
so
carrots.
therapeutic?
Yeah, I'm like, man, carrots are delicious.
Oh man,
Broccoli, carrots, just learning. And zucchini is easy to
I love
make.
zucchini.
Yeah, yeah.
I love it so much.
And it's about, replacing saturated fats with monosaturated, polysaturated fats can be beneficial.
Mhm.
Um, Decreasing the amount of cholesterol and salt. People are sweet or savory. I'm a savory gal, being Sri Lankan in background. We love spices. It took me a lot of time to realize that I was eating a very high salt diet.
Mhm.
I think it only dawned on me when I was like putting salt on a dish, and my girlfriend's like, "Are you serious?" She's like, "This is already really salty." And I'm like, "It is." Like, I don't care.
Uh-oh.
I was like, "Oh my God." Like, because you do really get used to certain palates. Like, if you eat a lot of salty stuff, it's possible that you don't recognize it as very salty anymore.
Mhm,
You know what I
mhm.
mean? Now that I cook at home and I see how much salt I put in, the chips that I used to enjoy, the whatever, I'm like, I'm thirsty after this. I'm so, you know what I mean? I'm like, I
Right.
can't, I can barely actually eat out anymore because I get so thirsty because I think the salt content is just too much for my body now.
Same, same.
Um, yeah, and then processed meat. We eat a lot of processed food, to be honest. I mean, that's partly because food companies want to have a better shelf life. Like
Mhm.
I always think is suspect when there is like pepperoni or what, like there was like meats and stuff that are just like out on the shelves. I'm like, oh, like
Yes.
how dead is that?
Right.
Like how, what is that?
How does that work?
How does that like tickle me? How does that work? Yeah, I don't know. I think we eat a lot of processed food and
Mhm.
sweetened beverages. I think uh, a lot of us have been fooled into thinking like, oh, it's natural juices and it's so whatever, and have a picture of an orange on the bottle. And these are things that I've fallen for. That's why I can speak so candidly about it. It's just thinking, oh, I'm drinking grape juice. It's so healthy. Well, did
All
you
that
look at the label?
sugar. Yeah.
Yeah, I think it was like, it's just exposing the food labels and what we consider healthy. And yeah, so those are things that you could do. And then in terms of processed food, I thought this article was really great.
Look at you. This is so great.
We do eat a lot of ultra processed food. I am so guilty of it myself. Again, I've for a long time let school get in the way of my health and not recognizing my health is important. Thankfully, I walked away from my training, 10 years of training, being healthy, thank God, but like things could have happened where I just really didn't take care of myself. So a lot of chips, a lot of, breakfast cereals also have a lot of sugar added to it. I mean, we're brainwashed to thinking that cereal is healthy, in a way, but it could be really coated in a lot of sugar. I mean, we start giving that stuff out to kids at such a young age.
Rotting teeth.
Um, I think, yeah, I'm just really kind of disappointed in my own self of things I used to think was healthy and how it just sort of wasn't. Sugary drinks is a big deal, and a lot of lunch meat has processed. Though I mean, I still do rely on lunch meat here and there because as when we're busy, sometimes it's like an easy go-to meal. But I have significantly cut as I'm learning more about food, as I'm teaching more about food. I'll cut down a lot of certain things. But again, when I talk to patients, it's sort of like being reasonable as well. Like do every once in a while. Do I eat lunch meat? Yes, I do. I
Mhm.
just don't eat it and say, look, I'm being healthy. I eat it and I'm like, okay, I'm just at least being convenient. At least it's a
Perfect.
small snack as opposed to ordering out or eating something worse, you know?
Mhm.
So some research has shown that we probably eat ultra processed food about 60% of total calories in America. And I truly believe that because when I work with patients, I do what's called a food log. I have them keep a log of the food that they eat. I don't really think that I'm at a place to tell you what to eat and drink because I am a normal, healthy weight individual. I don't have a six pack and I probably never will. And that's
Who
okay.
does? It's natural.
No, these people I know naturally. Who does naturally? I don't know. Um, so to me, I'm like, you know what? I just want to be able to enjoy what I eat. Food's so important in every culture. Food is so important to me. Just being honest about I like food,
Mhm.
and I'm gonna have a nice balance of it. You know, what you have.
Yes. I'm like all into this. Okay, so what signs should I watch out for regarding a serious heart condition?
Oh yes, actually, I have a few of those.
Wow, look at this.
So in terms of women, well, it's hard to sort of say one specific thing because I don't want to be in a situation where every time you feel something that you run to the emergency room. Again, this is just education and entertainment. Uh, I always advocate for people to talk to your own physician because your doctor is going to know what your health conditions are and what to look for. Whenever I diagnose somebody with something, I say, listen, if this happens to you, it's no big deal. But if this happens, you need to let me know, right?
Wonderful. Yeah.
As a physician, again, this is a little idea of, all the training that we go through, which is extensive. And I say this because there's a lot of different providers out there. And I think there have been times when people get fooled to not knowing who they're seeing. So
Mhm.
a physician is an MD or a DO after their last name. And you have to talk to your physician about, what makes sense. But in terms of women's health, I made a little slide here. Women are really different from men because we have biological differences. And if women do go on to become pregnant, there are pregnancy related hormonal changes. And then there's menopause related hormonal changes. There's monthly hormonal changes, right?
You have to
And
do
then there's
something.
also societal expectations. So I have a lot of people who feel like they need to burden a lot of the pain. They need to take care, they need to worry about their problems, their husband's problems, or their loved ones' problems, or kids' problems, everybody's problems, their problem because they're the mother, that kind of thing, or family roles sort of go into it.
Mhm.
So that being said, there are definitely different symptoms. So heart attack in symptoms is a very common one, could be really different for women than for men.
Look at
So the
that.
common,
Wow.
what did you say?
I said, look at all of that. Wow.
I love your show and I wanted to make sure that you viewers got something really great. Of course. I don't do 50%, I go all in,
I
okay?
love it. I love it. Thank you.
Movies, you see this person sort of clenching to the chest, it's dramatic, and they fall to the ground, and that's a heart attack. And that's not always how it presents. Now, some of them are actually pretty dramatic like that.
Mhm.
Like it could be like a little bit of nausea and vomiting. And the reason I said please talk to your doctor about these symptoms because how many times have we been nauseous? You can't think every nausea is a heart attack. I don't want to sort of promote, I'm not like, I don't want to promote fear like that. That's like not the purpose of this. But in a certain type of person where the risk factors are there, you have to have this heightened awareness to be like, wait a minute, this is not right. This is not normal. Jaw pain, neck pain, chest pain. If you have chest pain, like I think don't ignore your symptoms. Time means a lot. There is no pause, there's no rewind, there's no redo. This is life and it just happens and it can change you in a split second. So I think your viewers are young. So like let's say I see this a lot in the 60, 70-year olds. So I'm imagining your viewers taking care of their parents, right? I've had people who say, well, I felt this facial droop, so I went to bed. I'm
Ooh.
like, my God, no, 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 that's not what we do. I
Mhm.
had chest pain, so I just went to bed. Absolutely not. If your family member doesn't look good after a meal, after whatever, pay attention to that. Don't let them convince you that it's nothing. Just pay attention, be vigilant.
Mhm.
Shortness of breath, fainting, even indigestion could be a sign of heart disease. And
Really?
I've seen several cases like this. Again, if something is not sitting right now, there are people who have reflux where they're like, this is my normal reflux. That's one thing. But
Mhm.
if something just really seems out of place or something like that, again, speaking to your physician, having had an established relationship like that will help.
Mhm.
I think before the show started, we talked about some of the things that are wrong with the healthcare system here in America. I think part of which is not giving the citizens an ability to have relationship with a primary care physician. In my mind, I said, wouldn't it be nice if you had one free visit to the doctor for everybody? I mean, I get it. There's so many different opinions about socialized medicine, single payer system, and I just, it's not. I'm here to just talk about. To me, I'm like, when people ask me questions, I'm like, I went to med school to like help people. Again, these are some, at the end of the day, the symptoms of heart disease, chest pain, dizziness, lightheadedness, even sweating, weirdly, or just having, like, let's say you go for a run. Of course, if you're running 3-4 miles, towards the end of the mile, you're sweating, you're panting, you're hopefully you got a good workout out. But if you're going up one flight of steps and you're kind of like really struggling, that is abnormal. That is not normal. Right?
Yeah, yeah.
You're having chest pain, you're getting sweaty with minimal activity. Those are little things to watch out for. Whatever people really do know their bodies best. So if something doesn't seem like it's sitting well, don't wait, because waiting can only make it worse.
I appreciate all this great information. So, what is a normal resting heart rate for a relatively healthy woman in her late 20s?
Perfect question. Heart rate can vary from 50 beats per minute to 100 beats per minute. So 50 to 100 is normal. Some sources may say 60 to 100, but really that's just a small variation in the definition. So 50 to 100 is what we consider normal. In a really young person who is very conditioned, so athletes can have heart rates in their 40s, 45. It's just that they have higher vagal tone. Different bodies are different. Like I have a few patients who are older who have heart rates that are like 49, 48, but that's their normal. So again, heart rate is matter of, yeah, you can have a normal heart rate and something still be off. Like you can have a different rhythm, underlying rhythm and such.
Mm.
So a normal heart rate, if you're just going to measure it, just measuring your pulse, for example, you can measure your heartbeat.
Mhm.
And those are some things that I'll have on my social media for February. So February is heart month, which makes this conversation perfect. But on my social media on healthyhearts.md, I'll talk about little ways of doing things on your own at home if possible. But yeah, heartbeat could be anywhere from 50 to 100 beats per minute.
Now, is there a way? Okay, so I have a Fitbit, and is there a way to, like, the Fitbit will like obviously track your heart rate and tell you what your normal resting heart rate is. But when it's like, here's some, like, it tells you to exercise more or to like do X, Y, and Z to lower the heart rate. Is that normal? Like, is that something you should be doing?
No, I don't. Why does it say that?
I don't know. I guess maybe if it's like too high, it considers, or
Like, let's say I give you really bad news. Okay,
Mhm.
something happened. You're gonna feel like your heart's jumping out of your chest. Like you're about to go to a big meeting. You're about to speak in front of, your heart rate's allowed to be 101, 102, 110. Now you're a young individual, so your resting heart rate, so there's something called maximum predicted heart rate, which is 220 minus your age. And that's a little ballpark. At the end of the day, bodies are different. We don't have a blueprint of how we came about. I say that to really help you realize it's not like an exact science. It's not like 2 + 2 = 4, or your computer breaks down and you should know exactly how to fix it because that's man-made. We are not man-made. Like there's so many different varieties that go into it. So if you're anemic, again, some people might feel like around the time of the month or right after that they feel sluggish, they feel it could be anemia, it could be thyroid issues. So different things can make your heart rate a little bit higher. When you exercise, your heart rate goes up.
Mhm.
There's different things like that. So I don't know why your Fitbit is
Or
saying
not mine.
that. Somebody else's.
Somebody else's Fitbit built them this.
um, there are obviously watches like the Apple Watch will keep an actual like a rhythm recording, and it's actually cool. There's so many different stories of the Apple Watch catching AFib, atrial fibrillation, which is a
Mhm.
very common arrhythmia. So, like, let's say you look down, you're like, oh my God, my heart rate's 110. You're not gonna die, okay? It could mean that you're anxious. I think a lot of us have I don't want to say anxiety disorder, but man, we have a lot of stress. I don't know if it's just me and my friends because we're all in medicine, or most of us are, but I think it relates to every person because,
Everyone, especially 2020, I think like
yeah,
everyone's stressed. Everyone's at the therapist now.
yeah,
Well, okay. Next question says, "What you'll have to help me with this word? I what is inappropriate sinus tachycardia?
you got it.
Is there a cure and is it hereditary?"
So, great question to the follow up of the heart rate. Inappropriate sinus tachycardia means that your heart rate is fast without a good reason.
Okay.
So if let's say, and people are very symptomatic from it, it is an under-recognized disease. I think it affects a lot of women.
Hmm.
I have several patients, very handful of patients, to be honest. It's not a very common thing. I think it takes a while to be diagnosed, but I've had plenty of people who I've started on medications and they've felt better. All that means is your heart rate's usually above 100 beats per minute for no good reason.
Hmm.
If you wake up in the morning and you drink a coffee with espresso or whatever, your heart rate may be high because of the caffeine intake, the soda intake. There's caffeine in many sodas, for example. Like people don't recognize their Coca-Cola, their Pepsi may have caffeine in it. Chocolate has caffeine in it. Energy drinks obviously do. Or like sometimes people might not realize some of these like specialty drinks, like they still have caffeine. Tea has caffeine. So again, when you have a fast heart rate, you have to ask why is it. So when somebody comes in, let's pretend like you're here and you're like, doctor, my heart rate's really fast. My Fitbit said it's always 110, and I'm feeling
Mine, not
okay.
mine.
Um, let's make a fake person.
Jane.
um, Gene comes in with a fast heartbeat, and we do a workup to see why that is. Is it Gene's thyroid? Is Gene anemic? Is their hemoglobin low? Are they anxious? I mean, we have to attend to the underlying cause. Do they need either medications or therapy? Do they have an infection? Do they have some underlying cause for why their heart rate's elevated?
Mhm.
If the answer is we do a workup and we can't find something, some people might even put like a monitor on. It depends on really the workup, where we say, look, your heart rate's really fast most of the time and we don't know why. And sometimes it's sometimes hard for people to recognize anxiety, I think.
Mhm.
Myself being one of them, I was really unrecognized when I was a fellow. Thankfully my like family doctor was phenomenal. He like caught it right away. He's like, you're just really anxious. And I sort of worked through, I was like, oh yeah, work 100 hours, getting married. Mom and dad are like all about the wedding. Why would I not be it? You know what I mean?
Yeah.
Like now looking back, I'm like, were you really like questioning your doctor? Like you really didn't think you were, you know what I mean? Um, but inappropriate sinus tachycardia is a diagnosis of exclusion, which means we do an extensive workup and we say your heart rate's fast. We don't know why it is. Most of the time, people can do different things, whether that's breathing techniques or yoga or sort of centering themselves. Other people do end up needing medication. So there are several medications that are out. Again, when doctors start you on medications or what have you, any cardiologist is going to know what inappropriate sinus tachycardia is because we learned this as part of our guidelines. Actually, there, when I was looking up for the conversation, I meant to put it in here, but there are guidelines out called every few years. The guidelines get updated from our major societies that we belong to, and there are medications that are available in the right person, and then it's. I think the second question was the second part of that was whether it was hereditary.
Yeah.
I have not seen that. A lot of people don't know the mechanism behind inappropriate sinus tachycardia. So I've had one or two people who kind of had sort of similar-ish presentations in the family, but it's not thought to be like a hereditary condition. But if somebody says, hey, my mom had it, my grandmother had it, we're like, okay, I guess it's hereditary. But it's not one of those things that we say, like if you had breast cancer at young age and or your mom and your grandma, your aunt had it, we go, this could be hereditary, this is dangerous, like you need to get screened, whether it's colon cancer, whatever. But inappropriate sinus tachycardia is not one of those things, so we don't think of it as traditionally like hereditary.
Got it. And so I guess the cure for it would be just like monitoring it in the medicines that you mentioned.
The cure for it would be to see if there is an underlying cause for it. Okay, so if it's a thyroid issue, like high thyroid function can cause high heart rate. So then fixing the thyroid, curing the thyroid will fix the heart rate. Other times it's treating it. So I guess that the right way to think of it. So people do get treated. So I've had in my training, I had a few patients who had inappropriate sinus tachycardia, and they were treated with medications in really rare conditions, rare cases. They have to do a procedure to fix the heart rate too.
Oh, really?
Yeah. So if whoever asks this question, go to a cardiologist. If you don't think you're getting the right, go through the workup. If you don't think you're getting the right, whatever, just keep advocating for yourself. Electrophysiology are the ones who may specialize in heart rhythm issues. So EP or electrophysiology. So
Thank you so much.
you're welcome.
I learned way more than I don't know. Thank you so much for doing this and talking to my community about this, answering our wonderful questions. Is there anything, like, since we're wrapping up, is there anything that you'd like to add or you want to share, you feel like everyone needs to know?
Yes, I think healthcare in this country is frustrating. I feel like it's sort of set up in a way to make it really hard for people who don't have a family member who's a doctor or a nurse to navigate it. There is no easy way. Don't let that sort of sway you away from advocating for yourself.
Mm-hmm.
Step one is to establish care with a family doctor, primary care doctor, who is really going to look at you a different way, look at your family history, and really bring a plan out for you. Especially if you have health, like use your health insurance, your employer pays for it, you are paying part of it, whatever the case is. Do advocate for yourself. And again, if you don't have health insurance, try self-pay, DPC. I'm going to just go ahead and advocate for preventive health. If
Mm-hmm.
for some reason you really can't get to a doctor, which is very reasonable, just try to be as healthy as you can. The other component that we kind of didn't get to was the physical activity component, which a lot of us are not moving enough, myself included. I wake up, I get in my car, I go to work, and then I am standing around a lot, but
Mm-hmm.
that is not being physical.
Mm-hmm.
And then I come home and then I sit on my couch, and that's my day.
Yep.
I'm exhausted, I'm tired, I can't move, but I did not get physical activity.
You know what's a really fun? I love fun workouts. Like I love like dancing and doing stuff like that. And
Yeah.
I recently got really into like Pilates, like doing these other videos. But
Oh, wow.
a really fun like workout thing to do is a hula hoop. It's like a weighted hula hoop. And it's like, I was like, this should be easy because I used to hula hoop for hours. The weighted one like gets your heart rate up, it works your legs.
Really?
So check it out.
I think I
I'm
will.
helping you.
That actually sounds really fun.
Yeah, it's so fun to listen to music while you do it. And I don't know, it's just like a fun way to, you have to have like a little space, obviously, because it's a hula hoop, but
Right.
and you can do it like in a driveway or just like out wherever you can, but a little fun thing to do.
Next week, we'll do like Saturday morning hula hoop with Bria.
There you go. Well, I appreciate you so much for doing this. I know you don't have a lot of time to give, but I thank you for being so passionate and, helping bring my passions to life by interviewing you. So I appreciate it. Thank you so much. If my viewers have questions for you, they can find you on Instagram at healthyhearts.md. That's the best place to find you, right? Perfect. Well, thank you. And thank you, viewers, for tuning in. We will see you next episode.